What is BIA-ALCL?
BIA-ALCL is a very rare lymphoma that we're seeing very infrequently after many years of exposure to heavily textured silicone gel implants.
What are the symptoms of BIA-ALCL?
The symptoms usually are very subtle. Most of the patients will present with a seroma, or an enlargement of the breast that's due to an accumulation of fluid around the breast. Rarely there'll be some thickening or changes that one can see on an MRI or on ultrasound in the capsule itself.
When should a patient be evaluated?
The FDA, when they reapproved silicone gel implants, suggested that patients have an MRI at years 3, 5, and 7 post breast implants. Because of the cost of the MRI and the inconvenience, at least in my practice, most patients have not adhered to that. Over the last 8 years or so, we have been doing ultrasound, and ultrasound is very cost effective. We have not charged patients for it at present, and it can be done in less than 10 minutes in the physician's office. So I think that it's reasonable that every 2 to 3 years, even if you're asymptomatic, it's certainly nice to know that your implants are doing fine with an in-office ultrasound.
Do patients need to have their implants removed?
If you have heavily textured or textured implants at all and are totally asymptomatic, I would suggest that you have an ultrasound. In the absence of finding anything wrong with the capsule or any fluid around the implant, there is no science to suggest that you should have your implants or the capsule taken out.
I have Allergan BioCell implants. What should I do?
If you have Allergan implants, these are the implants that have been most implicated with ALCL. I think it's important that we evaluate you as a patient and make sure there is no seroma or fluid collection around the implants. If there is a seroma, then we will sterilely try to sample some of that under ultrasound in the office and send it off for an examination to rule out ALCL. If you're totally asymptomatic, I still think an ultrasound would be helpful.
I have a textured implant, but my implants have not been recalled. What is my risk for developing BIA-ALCL?
At present, no one really knows what the risks are for each individual implant, but overall the risk is very, very rare. We think it's around 1 in 30,000 patients. So if you don't have an Allergan implant and just a textured implant, then just some type of surveillance program with ultrasound every 2 to 3 years is warranted.